Hello everyone. In today's class we will see about EEG placements of electrodes. EEG is nothing but electroencephalography. It is measuring the electrical activity of the brain. Electrodes will be placed in the scalp area and the electrical impulses from the brain will be measured using EEG. The frequency of the waveform will be varying from 0.1 to 100 and the voltage will vary from 2 to 200 microvolts. The requirements for EEG measurements are there should be 8 to 16 channels. The electrodes will be either in cup shaped or disc shaped. The electrode jelly should be placed and rubber cap can be used, and the room should be a comfortable one, and the measuring tape should be used. So this is a diagram which represents the earlier generation of EEG and the current generation of EEG. The shape of the electrodes will be cup shaped. The electrodes that are shown here are cup shaped electrodes. So the brain is divided into 4 lobes: frontal lobe, parietal lobe, temporal lobe and occipital lobes. Frontal lobe is used for emotion and motor control. Parietal lobes is used for sensory purposes like pain, touch and pressure. Temporal lobes is used for auditory system, sound system, and occipital lobes are used for visual purpose, for seeing. The brain is divided into 4 parts. So the electrodes, either 20 electrodes will be placed in the scalp area for measuring the electrical activity of the brain. These electrodes will be distributed throughout the brain scalp area. So the lobes that are placed in frontal lobes are termed as F7, F3, F4, F18, and those placed in parietal lobes are named as P3 and P4. Temporal lobes are named as T3 and T4, and that are placed in occipital lobes are named as O1 and O2. There is a cortex area. The electrodes that are placed there in cortex region is named as C3 and C4. There is a center line that divides the brain. The electrodes that are placed in center line is named as FZ, CZ and PZ. So this is the placement of electrodes. This image shows the placement of electrodes that are normally placed. The rubber cap is placed in the scalp and the electrode will be displayed like this. Let us see the procedure how the EEG is measured. The patient will be kept in a closed room which will be silent. The procedure will be for 1 hour. If the patient is a child or a mentally retarded person, the person will be engaged with videos or they will be chit-chatting with their parents so that they are not disturbed. The long hours of EEG measurement is one of the disadvantages in EEG measurement. The electrodes are placed, 16 to 20 electrodes are placed in the scalp area by the technician using the electrode jelly. The electrodes will pick up the electrical impulses from the scalp area, and these impulses will be sent to the device for measuring the EEG. Okay. Why we are using EEG measurement? So it is used for measuring the level of brain activity in a human being. So the first point is that it is used for measuring the level of epilepsy, and it is commonly used in coma patients, and it is if the brain is injured, this EEG measurement is used, and in cases of brain tumors, dementia and hemorrhage, this EEG should be measured. There are types of waves that will be obtained in the EEG measurement. These are alpha waves, beta waves, delta waves and theta waves. So alpha waves are found in normal persons when they are awake. The frequency range is between 8 to 13 Hertz. When a person is in a calm and a relaxed stage, this waves will be present in the EEG. Beta waves are of 2 types, beta 1 and beta 2. So which is inhibited by, beta 1 is inhibited by cerebral activity, and beta 2 is excited by mental activity like tension. Beta waves are normally in the range of 13 to 30 hertz. If you are solving some problem in mathematical equations, this beta waves will appear in the EEG waveform. Then next one is theta waves. It is obtained from temporal region of the scalp from children, and it occurs during stress and frustration. The main frequency will be between 4 to 8 hertz. When a person is daydreaming or if he is drowsiness, this wave will be obtained in the EEG. So, in cases of brain disorders for our children or premature babies, this waveforms can be obtained. The next one is delta waves. It is obtained from the cortex region. The frequency normally obtained is 0.5 to 4 hertz. So, look at the waveform. This is a EEG waveform that will be obtained either in a computer screen or it can be recorded in a paper. So, applications of EEG mainly for detecting epilepsy and for brain death testing. In cases of cancer, brain cancer or sleep disorders, narcolepsy, this EEG measurement will be done. During sleep paralysis and during chronic hypersomnia or sleepiness, this EEG measurement will be done. That's all. Thank you.